Good evening and welcome everyone to Coffee and Conversation. Today's topic is pregnancy, gun violence, and lethality, the Black survivors experience. My name is Ayana Wallace-View. I'm the training manager with Ujima Inc. And Ujima Inc is one of few nationally designated culturally specific resource centers, similar to Esperanza United, who was formerly Casa de Esperanza, or similar to the Asian Pacific Institute on Gender-Based Violence, or our sister resource centers. We at Ujima focus in on the needs, realities, experiences of Black women and girls and of the Black community as a whole. I'm joined here today by some amazing folks I can't wait to introduce, but let me go ahead and give a quick description of what we're talking about today and why we're here on the call. In the meantime, feel free to, I know it's a recording, but feel free to grab some coffee or tea, get comfortable as we lean into this conversation. So thank you all for joining us today for this conversation around the ways in which gun violence and intimate partner violence disproportionately impact Black survivors during pregnancy. We'll also explore Black survivors' realities with reproductive health and maternal mortality, and our panelists will be able to highlight some best practices for advocates, as well as some really useful, culturally specific and nuanced prevention and intervention strategies. Some quick objectives for today. We're going to be really leaning in, identifying and discussing risk as it applies to Black survivors in pregnancy. We're going to look at some of the ways in which Black survivors experience violence at the intersections during pregnancy and after, and also be able to really talk through how advocates, again, can best support survivors during pregnancy and beyond. So I want to go ahead and start with introductions. I'll start out with one of my teammates, Millicent. So glad you're here. Millicent Shaw Phipps is the Director of Legal Programs with Ujima Inc. Millicent is primarily responsible for overseeing programs of the legal department, as well as the technical assistance and training that addresses racial justice, historical trauma, and gender-based violence when survivors from the Black community access legal services. Before joining Ujima Inc., she served as the Director of the National Center on Protective Orders and Full Faith and Credit for 18 years. Millicent was also a staff attorney at the American Prosecutors Research Institute, the Research, Training, and Technical Assistance Division of the National District Attorneys Association. She is a graduate of the University of Washington School of Law and is licensed in the states of Maryland and Washington. Thank you for joining us, Millicent.
Thank you.
Next up, we have Virginia Duplessis, Associate Director of Health at Futures Without Violence. As the Associate Director of Health at Futures, Ms. Duplessis provides oversight for a range of initiatives designed to improve the public health response to violence against women and increase the capacity of domestic violence service providers to address the health needs of their clients. She serves as the director of a federally designated National Health Resource Center on domestic violence, leading several multi-sector collaborations to increase health equity, prevent childhood trauma, and develop health policies that prevent violence. She brings over 20 years of experience in domestic violence, sexual assault, and the public health fields. Virginia has worked extensively with healthcare and social service providers, developing training and educational materials on a range of health and behavioral health issues within local and state public health organizations. She is trained as a social worker and doula, interesting, and serves and also works directly with community members and has worked directly with community members, youth, and victims of violence, as well as advocates, counselors, and prevention, as well as an education, She's also worked as an advocate, counselor, and prevention educator. There we go. Virginia has received her BA in communications from Stanford University and her MSW from UC Berkeley. Thank you for joining us, Virginia. And now we have Amber Goodwin, founding director of Community Justice Action Fund and Community Justice Reform Coalition, and now assistant district attorney of Travis County, Texas. Amber is currently serving as a Travis County assistant district attorney and founder of the Community Justice Action Fund. Community justice brings power with and for communities of color to end gun violence through policy change. Amber's work on gun violence includes serving as the gun violence liaison for the Biden-Harris presidential transition team, testifying in front of House Judiciary at the first ever congressional hearing on gun violence in communities of color, and helping to lead efforts to pass federal, state, and local laws that have funded $14.1 billion in support for local community violence intervention programs. Before founding Community Justice, Amber was a national advocacy director for Giffords, the organization founded by former Congresswoman Gabby Giffords and her husband, Senator Mark Kelly. Amber was also appointed as the chair of the Austin Gun Violence Task Force, which helped to create the city's first office on gun violence prevention, and currently acts as a liaison to the OVP through her work at the Travis County District Attorney's Office. Amber has spent over 20 years working on progressive issues, including policy campaigns, fighting for health and insurance reform, voting rights, and was a union organizer for SEIU's Justice for Janitors campaign. So thank you for joining us, Amber, as well. So excited to have you all here. I think let's go ahead and jump into the questions, because as you can tell, I'm very excited about this conversation. So I think the first question I think we should go ahead and frame and get out the way so everyone has a good understanding is, what is reproductive abuse or coercion, and how is reproductive abuse used against Black survivors? So anyone who wants to start, jump in.
I can go ahead and jump in. So at Futures at the Health Resource Center, we do a lot of work around reproductive coercion and helping healthcare providers and advocates understand how it impacts survivors. And it's basically a set of behaviors that are used to control reproductive health and reproductive outcomes. So a couple years ago, there was a lot of talk about reproductive coercion because one of the strategies is birth control sabotage or stealthing. So if you have a partner who is poking holes in condoms or hiding your birth control pills, things like that. So that's one element. And then there's also pregnancy coercion. That's part of reproductive coercion. So controlling the outcomes of a pregnancy. So it could be forcing someone to give birth when they don't want to, or forcing someone to terminate a pregnancy if they would like to continue a pregnancy to term. So, you know, for me, I think we have seen over and over again, the ability to control your reproductive health and reproductive life is key to reaching, you know, your full health and potential. And so this is a very troubling set of behaviors. And one study showed that about 25% of survivors who were asked had also experienced reproductive coercion as part of, you know, the power and control dynamic. So it's not just like a one-off thing. It's actually pretty prevalent.
Thank you. Amber and Millicent, anything to add?
I would just add that it really is important to recognize these sexually coercive behaviors that are utilized in reproductive abuse or coercion, forcing people to have sex with you or retaliating when someone won't have sex with you, intentionally giving people STDs and then being retaliatory when they test positive for STDs, and how that can also manifest when a survivor may or may not want help. So say, for example, you have a situation where you've been forced to have sex with somebody and then you want a protective order. You now are going to have to disclose this awful situation as the basis of your protection order. And that shame that is put upon women for their sexuality, you know, having a judge you, having everyone in the courtroom hear about it. A lot of, you know, abusive partners will know that, you know, people don't want to go to court and talk about their last sexual experience. So it's not going to be, or if you decide to terminate a pregnancy or any of the things that women are shamed for, they can be used against survivors by the system to not even get help. And abusers know that.
Yeah, and I would just add, tangentially, but very importantly related to that is just the introduction of a firearm into any of these situations and how we talk about coercion, but also coercive control. And I think we'll talk a little bit later about this, but just how many times as a society, we don't even think of these non-fatal ways that women and Black women are impacted when there is the mere presence of a firearm in a house. And a lot of these statistics go back and forth. I probably think it's probably more than this, but it's a woman, because we mostly have statistics on whenever it comes to gun violence on same-sex, not on same-sex partners, but on male and female partners. But a woman is 500 times more likely to die by firearm violence if just the presence of a gun being inside of a home, if there is any sort of domestic violence or interpersonal violence. And there are millions and millions of women today that have experienced coercive control with a firearm. Just having the firearm laying next to them at their bed, they're pregnant and someone has it next to them and they have to go to sleep. Doesn't mean that they pointed it at them, but just the mere presence of it. And so I think that the conversation on coercion, especially in our communities, may look a little bit different just because there are just so many guns that are also in our communities as well.
Yeah, thank you so much. So it's shifting gears, but just a little. When we think about weathering, or the concept of weathering, which really proposes that the accumulation of racial stress over a period impacts or weighs heavily on Black women and Black women's lives at disproportionate rates, especially with racial disparities or disparities within the healthcare system, for instance. In what ways does weathering show up in Black women's interactions with different systems, or because of Black women's interactions with different systems? And how can we better emphasize its impact on Black pregnant women?
You want me to go first this time?
Sure.
I think the term weathering is very interesting, and it's almost a way to address all the microaggressions and other things that people go through and how it has a toll. There is a toll for all of these things that we're talking about on someone. So when you first asked the question, my first thought was, it makes people not want to participate in systems. That's one of the things, because systems can do bad things, because systems are not racially equal, because systems are not, economically beneficial. They're not accessible to everyone for many different reasons. It could be they're not accessible to your neighborhood because you don't have the ability to get to the courthouse or to the hospital or whatever system you want to access. And the overarching racism that exists in so many systems, when you access them and then you're victimized again, it doesn't make Black women want to run to systems, because one person has a bad outcome, and then you tell your sister and your friend and your auntie, and now we all know that happened. It's kind of like customer service. They say that, the customer tells 6 of their friends, and now those 7 people don't want to go. That's kind of how community is, right? It's like when something bad happens and then we tell, and then that group of women now all know that's what happens when you go there. And I do think that is, for me, it is just an absolute hesitation in wanting to access systems and resources.
Virginia?
So when I first heard this term weathering, it made me think of a different analogy. I live in sunny Southern California. And if you put your lounge chairs out, the sun shines down on it and they get weathered, right? They go from like a vibrant red flowers, and then suddenly everything is gray. And I feel like that is the impact that it has on Black people, right? We are not able to, or it takes a lot for us to be our full selves, because we have this historical experience of violence, trauma, and abuse. I also think it's really interesting that they chose the term weathering, since many of us have a legacy of chattel slavery, where we spent a lot of time outside in that sun, right? Like, there's no coincidences in any of how this is being defined. And I think what I try to do as people are, talking more about the Black maternal health crisis and what are we going to do on this individual level, to remind people that it's not just individuals doing a better job, but it's a whole system that needs to be transformed. And even if you have a cadre of awesome, caring providers, there's so much historical baggage and actual physical impacts of what our community has experienced that you need to kind of like reckon with that. Again, just really thinking about those systems level things that need to change, because I think it has been proven over and over again, if we continue to focus just on individual level behaviors, policies, and changes, that is not going to be enough.
And Amber, I'm interested in if you've seen how it's played out in the court system with survivors having to navigate the system.
Yeah, I mean, I think one of the first things before I came to the district attorney's office and played more of an advocate role, I thought all the time about the way that even survivors see themselves portrayed, and whether or not we are even decidedly survivors, because the media many times, for people who look like all of us, don't think of us as survivors. We're not blonde, we don't have blue eyes, we don't have all these different things. And so I would say that in the last over a decade that I worked primarily on gun violence, I can't explain, and I don't have to explain to all of you, just the amount of poor health outcomes I physically saw from mothers who had lost children, from advocates who had never been shot themselves, had never witnessed a shooting, but come 2020 with everything that happened that year, but even before that in 2014, when Mike Brown was killed, just the visceral reactions. And so I think, just in the court system, it's been very, challenging. We have a long way to go. But I also think about when I heard this question, I also thought a lot about what the role that social media even has to play in what we have to weather. Because I remember when Breonna Taylor was shot and killed, when all these other things are happening, when we're seeing these videos play on like social media and things like that, I don't want to see it. But there are times when I know I have to see it, either for work or for other things. But I say all this to say that I think weathering is not just the physical, like what's happening to us, what are we weathering every single day, but it's like, what are the different, as Virginia said, what are the different systems that we just have to be a part of because we are walking around this earth as human beings. And it's really hard to get away from the fact that there is a Black pregnant woman who was shot 5 times by a police officer. Like I want to get away. I don't want to see that on the TV all the time, but it does, there are so many studies, and I'm sure all of us could cite, about the amount of violence, whether it's through guns or through systems, and how that is directly linked to poor health outcomes. Poor health outcomes for mom, poor health outcomes for baby. And so I think it's, again, all part of the same systemic challenges that we see. There are, obviously some great solutions that people have come up with, but I think that it's all part of looking at the systems and how we are perceived, but also how we are navigating the different systems that we have to as Black women.
Yeah, thank you. And with this whole weathering piece, I don't want to move away from it before talking about advocates as well, and the impact that all of this work and our lived experiences has on us. Can we talk about that for like 2 seconds, and what folks' thoughts are, what they're hearing from advocates, especially Black women in the field doing the work?
Well, my therapist would be so grateful that you asked that question that I see every single week, because I think it's incredibly important that we talk about this, because I used to introduce myself in the gun violence prevention work as I would describe myself in the work that I did, but I had the unearned privilege of not ever having been impacted by gun violence. This is my first couple of years, right? Unearned privilege, all these like buzzwords that I heard probably in some class somewhere. And what I meant from that is that I've not been shot, and no one in my family has been shot. And one of the advocates, the frontline activists that I work with, pulled me aside and was like, you do have trauma. She's like, I've physically seen you change working in this work. This is trauma that we are all carrying along with us. We've lost loved ones, people who have died by firearms, whether it's by, community violence, or whether it's through dying by suicide. So there's just all these things that are happening as advocates. And I know I personally have not taken care of myself, and I've seen other advocates do the same as well, because we also as Black women are supposed to be, very strong and resilient. And that's why I've been so proud of like the NAP ministry, and so many just dope Black women who are doing these things that are cultural, and we deserve it as well. And so, you know, I think we deserve to rest as well, but it's been really hard, especially in this work.
Ellison or Virginia?
Well, I was going to say the acknowledgement that Black women need rest. You know, we usually are not even afforded that grace because we're supposed to keep working and working and working. And unfortunately, with intimate partner violence, we have a job. I mean, it's, you know, gun violence, all these issues are so prevalent in our society. We have a job 24 hours a day. There are people who are suffering and we don't really have all the solutions, but vicarious trauma is real. I mean, people burn out from this work. So you look around and, you know, we have this panel now, I mean, 5 years from now, not all of us will be doing the work anymore. People cycle in and out. Also, it's not the highest paying work. It is very rewarding because it is work that needs to be done. Working on behalf of our community is so important, but this is not being a partner at a law firm, having a house on the bay. This is, you know, my friends and I used to call it poverty law. It's like work for the good of the people, but not the money. And I think that advocates and a lot of other jobs where you're doing good work and you're doing service oriented, you're representing communities, they really are not. It's like being a teacher. It's not recognized by society as being something that should be rewarded with high pay or should have really good leave, because we need vacations in order to relax from the work. You really do need some time to actually pull back. Unfortunately, firearms violence is so prevalent in our country. There's not a lot of time to have a break, because if you do a news search tomorrow morning, there'll be some stories. Something is happening right now. Someone is getting harmed. There's gonna be some firearms. And if it's not in a house, it's at a school, because it's the United States. It's like, this is what we have, unfortunately.
Virginia, anything else to add before I move on?
No, I think I would just say, you know, thinking about the weathering that happens based on being a Black person in this country, the vicarious trauma from being an advocate, and then many advocates are also birthing people, so they may have had those experiences during pregnancy and afterwards. I mean, there are just a lot of layers, and so we need to be mindful that we are creating, you know, new opportunities and resources for rest and rejuvenation for our workforce.
So Amber spoke to it a little already about the relationship, I guess, with law enforcement or police and communities, but how can advocates and communities reframe police and community violence as a reproductive health issue?
Anything that limits our ability to have the families that we want, that is a reproductive health issue, right? If you are in a community where there's gun violence, police violence, I mean, there's no way that it's not, if we had like, everyone's like into the multiverse right now, right? Like if you could see a world where these things didn't exist, how different would our families look right now, right? Whole families, thriving families. I truly believe, yeah, would be a reality. More of a reality.
Thoughts? I think Virginia spelled it out nicely.
I'm like, I like that answer. Like,
yeah, I was like,
you know what she said, that was good.
I think it's, yeah, I mean, I don't have anything any more profound to say than that. I was just gonna add that, you know, we have fundamental rights in this country. Despite, I know we're still working on, we don't all have life, liberty, pursuit, we don't have all of that. We're still working on life, but you know, we have rights to walk down the street and not be harmed and not be shot and to birth people. And it shouldn't matter what you look like or what your zip code is. And those rights are being violated because of the immense amount of segregation, of racial disparities, of all these different risk factors that a lot of us can't get out of because from no fault of our own, right? And so I think that thinking about the fact that, you know, we have the right to do that versus like this is some burden that we must have as Black people in this country is really important. But I also think that, when we talk about community-based violence, especially when we talk about guns and gun violence prevention, there are folks that are on the front lines, of these movements and have been for 20, 30, some 40 years, doing this work, and they have little to no resources to do that work to help keep us safe. And in many other cases, other parts of the system have tons and tons of money. And so for many of us as gun violence prevention advocates, what we're asking for, and actually have gotten in some cases across the country, is just to actually fund, we call it Safe Fund Peace, like fund our neighborhoods to be peaceful, fund our communities to look like, we see on TV sometimes. And so, yeah, I think like funding intervention and strategies that actually work. And I would also say, we all probably work in systems where we're like, what does the data say? And is this data driven? And where's the evidence? And I'm like, hold on. If that was the case, we would still be in the 1930s if everything had to be evidence-based, or have we need some ability for innovation, because as Black people, we are the most innovative. And so I think when it comes to how we're thinking about these different strategies, whether it's policing or whatever it is, that having innovation for people who are directly impacted, the most impacted, and that's, Black trans people, that's, people who are low income, things like that, that can actually make up these solutions versus it being, just politicians that are doing that too.
And Millicent sort of alluded to the history of gun violence in our country, but considering the history of gun violence within the context of the US currently or historically, what should we say to Black pregnant survivors who are considering arming themselves in order to protect themselves? And I know this is like a whole conversation. We could really have like a whole separate conversation, but I wanted to ask it for a number of reasons. One, there's been a lot more conversation around Black people, Black women arming themselves just as a community. And in movies, and folks that are not as informed as others, they might automatically say, well, if you need to protect yourself, just get a gun. That'll handle your partner, that'll handle him, or that'll keep you safe. But we know that that isn't the actual reality. So can we talk about that a little bit? What are some potential risks? What are some potential benefits, if there are any? What are some thoughts that folks really should talk through as we're having these conversations?
You're talking about Black women arming themselves for whatever personal reason they would want to.
Yes.
So some of the risks would be if you're in a situation where your relationship has intimate partner violence, now you have a firearm in the home. So you've introduced a weapon into a situation where there are risk factors for you. That does increase the possibility. It's not guaranteed. It's not just because they're together, but it increases the odds that the firearm would be used against you. Are there children in the home? Are you using trigger locks? Are you taking a responsible gun ownership class and actually learning how to utilize the firearm that you have purchased? Because this webinar is not a moratorium on whether or not people should own guns, especially with what happened during the pandemic and all the racial unrest. There are many people who have purchased firearms and are lawful gun owners and are not using violence and do not have violence in their homes. Not a referendum on any of them. But if someone is in a situation where there is violence, there is a risk. There's also a risk that you may lose possession of the gun. So you could be the purchaser and then the batterer could then take it, or you could lose the gun, or it could be stolen depending on your living situation, and then it could be utilized for other crimes. Those are all risks to gun ownership. There is the potential for safety, but you can see from the stats in our country, if guns made you safe, we would be the safest country in the world. And that is just not true. We have the most guns in the world, and therefore we have the most gun violence in the world. So I think an advocate would really need to have an in-depth discussion with someone if they're approached, or a medical care provider, and the person said, I'm thinking about getting a weapon to keep myself safe. Maybe some of the discussion is, why do you feel afraid? And what are you afraid of? And let's work on some of those issues to try and come up with a safety plan that you can feel safe in your home and in your community. I I know that there is a push for women to get firearms. I mean, I've seen the ads, I've seen some of the stuff. I've been at conferences where there were, people who were, showing pink holsters and little pink pistols. And it's like, oh my gosh, we're at a DV conference and you're showing, firearms. It's not going to solve the violence, the interpersonal violence. That's still going to be there. And the risks are just going to be higher.
And I think even if you were in a situation, terrible, right, where you were able to successfully defend yourself, as a Black person, you are more likely to still end up imprisoned for that, right?
Yes.
So
Yes.
when you see these ads for the pink holsters, it's almost exclusively white women, right?
Yes.
That they're marketing these guns towards, because we know that if we do anything, even in self-defense, we are putting ourselves at risk of entering that racist criminal legal system that will imprison us anyway.
Right.
Amber?
Yeah, I don't actually have that much. I was just going to say that even though I just said that we don't need data and evidence for everything, I will say that the data and evidence that we do have on, owning a firearm is one, as Milson said, is not going to make you quote unquote safer. Depends on what your level of safety is. I know this is not a conversation on the Second Amendment, but there is data that shows, especially for people of color and Black people in particular, the rates of someone else using a gun against you if you are holding a gun. And so there is a higher chance / likelihood of another person using a gun against, a person of color that may be carrying a gun. Is that in all situations? Absolutely not. But I think, as everyone's already said, there's just so many different things to think about, including risk factors of why people feel unsafe in the first place. And so I would hope that there are safety planning and other things like that people will be thinking about first. And also what is making people feel unsafe in their communities, rather than just going straight to here's the one solution, because I think that there are many, many solutions to keeping communities safe.
Thank you. So how might pregnant survivors or parents experience economic abuse from their partners or even within their communities? And this could be broad, like this could be financial abuse, food deserts, lack of maternity leave or parental leave, whatever, however you're thinking about it, however you want to frame it. Go ahead, Millicent.
Oh, I got first. I was reading, I'm like, I've spoken first before. I mean, when you talk about things economic things, I'm always thinking like lack of transportation or transportation being taken, access to money to purchase healthy food or or withholding food. So maybe only the batterer can have food, restricting access to money to allow for items necessary to have a successful pregnancy, whether they be co-pays or prenatal vitamins, heck, more comfortable clothing, right? You don't stay the same size the whole pregnancy, all those things that can help make you more comfortable. If somebody is actually holding the purse strings, they can be restricted from you. Childcare help, childcare is not free. Or, a babysitter so you can go somewhere, or full day childcare so you can work. Any type of support for the children who are already born, that's part of the economics of it. That's my quick answer, sorry.
And thanks for starting us off. Virginia, any thoughts? Or Amber, go ahead.
Oh, no, I was just gonna also say, just +1 on everything that Milton said, but also just want to put a fine point on how challenging this has all been during the pandemic as well. How many Black women lost their jobs or didn't have employment before, so they're in the home with maybe somebody who was abusing them. Maybe they had a firearm as well, and it made it even worse because of the pandemic. And so I think that as we think of, the pandemic isn't over, but as we think of people going back into the work, which is how challenging all the economics were for all of us, maybe that weren't living with people who were in these same situations, and how that compounded just the last 2.5 years for so many people, and how hard it was to potentially even get into a new safer place. And what we also see in the court system, and whenever it does come to economics of whether you can afford to get away and whether or not you can get an attorney and whether or not you can pay for just so many different things that are systemic. And so I think that, yeah, there's just so much to think about, but the pandemic just exacerbated, I think, what we've all known to be true of how the economic kind of the purse strings can be so challenging for Black women.
Yeah, you know, there's that saying that money isn't everything, but money is something, right? You need a basic level so that you can at least survive. And what we're going for is thriving, not just surviving. And one thing that when I talk with healthcare providers is to remind them that they don't always know the full context of someone's life. So especially during pregnancy and after a baby's born, there's a lot of focus on like, you got to eat, you know, your fruits and vegetables and buy your prenatal vitamins. And why didn't you come to the appointment? And it's just remembering that not every person has control over their finances. On paper, someone could look like whatever, they have a nice fancy insurance. Like why can't you get your act together and take this childbirth class and, you know, get childcare, you know, for our appointments instead of bringing your toddler with you. And we just have to always remember that there's so many factors that we just don't know about. And again, just a call out to the systemic issues that we need to address, like, you know, a living wage, universal childcare, paid maternal health leave. We know way too many people who are staying in jobs that they don't want to because that's how they get their health care. I mean, just finances are a severely limiting factor for a lot of folks for making the decisions that they would otherwise make. They feel trapped.
Again, remember, people listening, remember this happens for advocates too, right? Which is why you have to pay advocates. You have to give them leave, like Millicent said. You have to make sure their benefits are appropriate to actually have them thrive as they're taking care and supporting and holding other folks, survivors, close. So Virginia actually mentioned this very quickly in the beginning, but I think it's a great time to actually go back to it. What historical policies and practices might have shaped the current state of birthing in the US? How are these historical practices observable in modern day issues? And how and why are Black survivors experiencing such heavy ramifications? So, Virginia, do you want to start us out?
Oh my gosh, I could talk about this forever. One piece of history that I just want to remind all of us. Okay, so right now we know that like cultural congruence between patients and providers makes a difference, right? If you are going to a doctor or a midwife or a doula who looks like you and maybe has the same kinds of experiences as you, there are better outcomes, right? It's obviously individual to individual, it's dependent, but in general, we see that being able to get services from someone who you share that kind of connection with is important. In the United States, Black people are grossly underrepresented in healthcare professions. This country actually started out where most births were attended by Black women. They were the midwives, the granny midwives that were there, that helped you figure out breastfeeding, that also were wet nurses. So it is like bananas that we've gone from a country where most maternal health care and childcare in early, infancy was provided by Black women, and suddenly you go and you take a look at, who the OBGYNs are, who midwives are, and nurses, and it just looks very different. And I think that overlay with all of the other experiences of racism, there have been studies done that healthcare providers think Black women feel less pain and are offered less pain relief during childbirth. I mean, there's just a million policies and practices that I could bring up that disadvantage Black birthing people. their babies too, you know.
And microaggressions as well. Like all of that's tied right up in there. Amber, any thoughts to share?
I just got angry all over about it. I mean, I was just also thinking, and I'm sorry for, I'm not going to remember her name, but just one of the law professors that was questioned about what are birthing people by the United States Congress earlier this year. And they were trying to trip her up, and she stood her ground, of course, because she was on the right side of the question and also history. But just even the fact that we have to have those conversations in this country when we know that many people can birth children in this country. And so, I mean, my sister is a neonatologist, my brother-in-law is an OBGYN, and I see from them firsthand the systems, right? My brother-in-law started his own practice, and I can't speak for him, but I think that probably part of the healthcare system was very challenging for him as a Black man, as an OBGYN for the last over 20 years, right? And so, which I'm so proud that he is starting his own practice with other people of color, especially Black people, Black women, Black trans people that can go to him and also feel very safe. But that's one person out of hundreds of thousands, if not millions, of physicians, physicians assistants, and healthcare providers in this country. And so, yeah, I mean, the historical implications, we could probably go back as far as like when they were, you know, when there was restrictions on our physical bodies, whether it was sterilization, different things like that, specifically with Black women for the last like 50 to 60 years. You know, obviously we have laws that outlaw that now, but I think that, you know, there have been many challenges that have been put particularly on, that have impacted, I would say, disproportionately impacted Black women, low-income women, women of color, Native women, that we just, you know, don't really talk about because we don't want to talk about how harmful it has been for us in the long run. And so I just think all the access to healthcare, different things like that have been very challenging, probably for all of us. So yeah.
Mm-hmm.
And Millicent, I'm sort of wondering how you might have seen it show up when survivors were trying to get protective orders after birth, or protective orders when children were being used as tools to manipulate. Any thoughts to share?
Well, I mean, children, you're talking about custody. that would be a whole nother webinar. Children are always going to be used as a tool to manipulate, because that was, I mean, for many women, they want custody of their children. They want to be safe physically, and they want their children to be safe. I think that what both Virginia and Amber were saying, though, was just really profound. I was very angry thinking about it, because I was thinking what Virginia was saying. Basically, what came to mind is the eradication of using like midwives and doulas, who historically were Black women. You know what you said? I was like, that's right. I actually saw a documentary about that. So I was like, I saw that movie. But you know what happened? It wasn't the eradication, it was the discrediting, because the Black women were doing good work. But to discredit them, we had to bring the doctors in. So now we have the medicalization of birth, right? And that's the system that we have now. It's medicalized, but it's racist. So when you have Black women who are treated like they can't tolerate, or they can tolerate a lot of pain, right? Because that's what one of you guys said. You said you can tolerate a lot of pain. So if you say you have pain, you're drug seeking, or you're attention seeking, or you're exaggerating. You can't possibly be as gentle, or need to be treated as gently as maybe you should be when you're birthing a baby, which is not like a party. Whereas midwives and doulas were more individualized attention. They actually were looking at the person, helping the person through. So when you talk about what do pregnant people or people who have recently had children get in the protection order system, they get the criminal justice and civil justice version of medicalized birth. Do you know who the father is? Does he have money? Do you have money? Do. And if you don't look the right way, and if you haven't done the right things, did you go to all your prenatal appointments? Did you test positive for drugs when you had that baby? Have you used drugs or alcohol anytime before or after this pregnancy? All the things the system will ask you. If you are not the optimal survivor, meaning you present really well, you speak, hopefully you have an attorney, you have money for a place to live, all of the things that just make it easier to transition through the system. If you're not optimal, the system will come down on you. You may lose custody of the baby. because of something that you did. Something you did at the hospital when you had the baby, something that a test that came out positive, something that looks weird with the baby, any question, you may lose custody. You could have an altercation in the hospital where the batterer now is doing something to the pregnant woman, but the altercation will alarm the hospital staff so much you would lose custody of the baby. No questions asked because you're part of it. The baby's not going to be safe with you. The system could make you go to parenting classes and do a lot of different things, which people will do because they want their children, but there's a cost to classes. There's a cost to having independent evaluators. There's a cost to having to have an attorney because there aren't enough free attorneys for everybody. The system will do its job. It's just not a equitable job. It's not a racially equitable job. It's not a just system. It's just a system. And that's after the medical system. Make sure your medicalized birth goes really well.
Yeah, and so that always, I mean, it just gets me to thinking about my shelter days as well, and like things that I saw that were just terrible, like terrible responses for Black pregnant folks in our shelters and in our programs, like terrible responses. So what then can advocates, even whether they're healthcare professionals or DV advocates, SA advocates, what can we do to better support Black pregnant folks as they're navigating these systems, or as they're navigating even just the healthcare system, like going to their appointment, what type of strategies or what type of resources can we offer?
I think we can offer cultural competent patient navigators that can help work with them. I think in a lot of the gun violence work that I do and others who work on community violence prevention, people think that it's, you know, a lot of folks walking around and saying, put down your gun, when it's actually very scientific, community-driven approach to taking a whole approach to the whole person. And part of that is working with women and families to make sure that they have what they need, so they are not in harm's way by a firearm or anything like that. But it does take cultural competency to be able to do that, and to be able to go into different neighborhoods, to have respect, not only just for the neighborhood, but also for the communities that are there and for the situations that people are going through. And so I think we work with a lot of people. I said community navigator. I don't mean like the kind of the traditional patient navigator, because I think that that's also, you know, I know less about that. That's part of a lot of the hospital systems, but we do have community violence interrupters. We have families that work with violence interrupters. We have healers that we work with that go into different communities that actually work with people, with pregnant people, that work with mom, with dad, with family members, with just anybody who is involved with a person who is going to give birth. And so I think having people that, you know, are trained, but also people who are from the communities is incredibly important, especially if they are potentially system involved or are going to need to go into some sort of system. And so I think having people from the community, but also giving, as we've all talked about as advocates, making sure that they are well paid. A lot of the community advocates that we work with, we just had to fight to get them health insurance. And these are people who have been doing this work and keeping all of us safe for 20, 30 years. They're getting paid low wages and they didn't qualify for health insurance through their government job or through their community CBO job or community-based organization job. And so just making sure that we're, as advocates, working with people from the community, but also taking care of ourselves as well would be important.
And so I know this isn't one of the questions we sent you all, but because folks have mentioned it, can someone just quickly explain why we are moving towards the language of birthing people and why it's not that scary to actually use that language?
I mean, I think Amber actually put it beautifully earlier. You know, we know that a range of people are giving birth. And so to really keep it on the binary of men and women is not, you know, really fully acknowledging and respecting all the folks that give birth. And so we're trying to move towards that more inclusive language.
Thank you. Very, very clear, very
That was very
quick.
concise.
Go ahead, Amber.
And I don't know the details, but I also think it's moving towards what science tells us and what we know to be true, right? Is that you don't have to look like all of us to be able to give birth in any place. And so that the fact is that you could look like, you know, someone else who looks very different from me and give birth to a person or give birth to a child. And so I know in some places, in some institutions, you know, people haven't gotten the language, but I also think that the learning curve for all of us was probably very short on learning that we needed to change our language a little bit. And so I think that that's, you know, trans people and Black trans people in particular have fought so hard for rights for all of us that I think that it's incumbent upon us to make sure that we get the language right when we're told and experience what we know to be true and to be the language that we should be using.
Mm-hmm.
And so we've also, oh, Bridget, did you have anything else?
Yeah, and like thinking about what we can do in the advocacy community to support Black birthing people. I've seen some programs that have some advocates who are trained as doulas, like letting them use their staff time to get the training and to flex their hours so they're able to attend births. I mean, you mentioned, you know, being able to accompany and support people when they go on their visits, you know, for folks who have already engaged in that kind of DV advocacy support. Definitely have more advocates who know about these issues. And then I think, unfortunately, the reality is that we have way more survivors that actually have never called a hotline or gone into a shelter or been in a support group. So as Ember was mentioning, like meeting people where they are, and whether that's a community health worker, a navigator, you know, where are the birthing people in our community, and giving those folks the skills to do a brief intervention and hopefully connect them with other people, with advocates who maybe have more information on safety planning and how to access resources. We can't depend on advocates to do everything, that's for sure.
Right, right. And we have mentioned COVID and of course the impact and ramifications that COVID had in our communities. Are there any other thoughts around how it specifically impacted Black pregnant folks? Or I'm just thinking about like when folks couldn't get into hospitals, what were survivors experiencing potentially? Anything else to add?
I mean, I think you hit the nail on the head. That was so challenging. Like I was not a birthing person, but I needed a myomectomy last year. In 2020, I needed to get a myomectomy. I was going to the ER. I was in so much pain. And for folks, myomectomy is when a fibroid removal. Fibroids impact, especially Black women, disproportionately than other women birthing people. And I was supposed to get it in May of 2020, and then everything was shut down. And then I was supposed to get it in July. And then so I say this as like someone who had access to a sister who was a neonatologist, a brother-in-law who was OBGYN, and I couldn't get in, and I was in pain for about 6 months. And that was somebody who had access to all these different resources. So I think that COVID, again, exacerbated everyone's experience with the healthcare industry, and it just shut everything down. Unless you were going to the ER, I think we probably all remember, but so many people forget that like March to almost November of 2020, everything was shut down unless you needed life-saving surgery. And even that, many people couldn't get in. And so there were people who were experiencing miscarriages, people who were experiencing all these other, you know, tumors, cancer patients that couldn't get in to have surgery. So all of that impacted birthing people and people who were impacted, their families as well. And so I think just the access was just completely shut off for such a long time. And then obviously it's changed a lot over the last year or so, but I think that had a lasting impact will have a lasting impact on Black women and Black people just in general for a long time.
I also think about the birth process, and, you know, unfortunately for many, like sexual violence is often a part of, and sexual trauma, part of kind of the domestic violence experience. And so there was so much restriction. People were giving birth by themselves. And I really, as a doula, felt for those birthing people who really needed someone by their side for that extra support, because giving birth can trigger a lot of painful memories and trauma, especially for folks who have experienced sexual violence. And so that was really, really heartbreaking to me. And then doing all the visits over telehealth and maybe not having providers hadn't quite worked out like how to do this in a way that was safe and confidential. And so they were still like doing domestic violence screens, you know, on a telehealth visit, and partner or person that the partner sent to surveil is sitting right outside of this box. And so really having to figure out very quickly, okay, how can we try to reduce some of the risks that this intense isolation caused, you know, for everyone.
And I think that's the key, that, I mean, all of us lived through the isolation. It was very isolating when everything shut down. And we're still trying to figure out the mental health outcomes for children and others, as well as ourselves, of living through. I mean, you know, my kids seem to think that I've lived through pandemics. I had to remind them this is my first one too. You know, they don't come around that regularly. So I don't know how to handle this because I've never been in one. But for pregnant people, they were isolated with their home environment. So for many, you know, people, that meant that they were actually isolated with someone who's causing them harm. And then you also have people who are afraid sometimes to go out. So then there is the lapse in healthcare, because did you really want to go to the doctor? Because you know what's out there. You know, it's like, oh, it's out there. And people didn't really want it. So you have those kind of things. And then what you just mentioned, Virginia, about people giving birth by themselves. I mean, I hadn't really thought about that till you said that. It's like, I can't even imagine. And I can't imagine what kind of care you get without somebody there to help advocate for you when you're going through something that is emotional and painful and not something that you really know how to just do. It's not like raising your arm. It's like you're trying to get a baby out of your body without any support people in a pandemic, in a hospital that has raging infections. And so you want to get out of there quickly because you don't want it. I can't imagine the alarm that people had to just find themselves so isolated. And then now you're just go back to your house because we're still in a pandemic. And how fragile people probably felt, you know, even on a good day when you leave the hospital with a baby, you're like, you're really trusting me with this one? Because I don't really know what I'm doing yet. You know, I mean, I need to stay for a week and you could teach me, you know, you don't really get a handbook of how to mother when you are given a baby at the hospital door. I panicked. I was like, please don't let me leave here with this child. So I don't know what to do. So I can't imagine what it would have felt like in a pandemic where I already was isolated, and then have a baby in isolation and then be expected to go back to isolation. Mm-hmm. That's got to have some significant mental health impacts for people. Unfortunately.
And yeah, very unfortunately. And so we know that rates of domestic and sexual violence are very high for Black women during pregnancy. Anyways, about 20% of survivors will experience violence during their pregnancies. Can you talk again or a little bit more about why these numbers are seemingly or are really in reality so high? What does this mean for Black pregnant survivors' experiences when going in for domestic violence services? And then any other thoughts to just really contextualize the experience around reproductive health or the relationship with reproductive coercion in particular? So that was a very multi-layered question. Anyway.
I mean, we do know that domestic violence kills more pregnant women than any other cause, right? Like the numbers are, you know, pretty stark. You know, we know that pregnant adolescents and women with unintended pregnancies also are at higher risk. So there obviously is a correlation between pregnancy and intimate partner violence and increased lethality. So for advocates and medical professionals who are providing services, it is important to have a conversation with people who, you need to find out if they're in a safe environment. I'm not saying the question is, are you a victim of domestic violence? Because that's not the way people talk about themselves. No one says, oh yes, I'm a victim of, of domestic violence, and the man over there who's the, father of my child also stalks me. That's not how people talk about their lives. But there needs to be an inquiry or a series of questions that will allow advocates and medical professionals to know that someone may be in a situation. Have you ever been fearful? Do you always feel safe at home? There are ways that questions can be asked that can at least elicit a little bit more information from the pregnant person, that maybe if the medical professional has an idea of resources, community-specific resources, that they can then refer the person to address whatever the concern may be. And those questions also honestly should be broader and talk about the presence and use of weapons. Do you have firearms in your home? Does your family hunt? And you don't have to say, are you going to get killed by a gun? But there are questions to ask to see what someone's home environment, have you purchased a gun for your safety in the last 5 years? There's no judgment behind that. A doctor can easily ask that. So could an advocate. And then go a little further with the questions. Have you ever been threatened by a weapon? Has anyone in your family ever threatened you with a weapon? Have you, just a series of questions that could actually let you know a little bit more about that person's reality, a little bit more about the presence and use of firearms in their life, and a little bit more about whether or not intimate partner violence is in their life. And then if you get the information, you have to have the resources and the ability to then help the person. It's not just ask the questions and check a box. Oh, I did that list. It's like now community and culturally appropriate resources. That would be the next step. And not saying advocates have to do everything, because I'm not putting everything on advocates, but to find services. So if someone says, yes, I don't feel safe at home, housing, then that's ding ding, housing is the issue. Yes, there are firearms in my house, they're not mine, I would like to get rid of them. Okay, know where to go if the client raises those issues, and that way you could provide support.
I mean, it is kind of mind-boggling that we know how, especially for Black women, and our Indigenous and Native sisters as well, domestic violence, homicide during pregnancy, I mean, that's one of the main causes. And yet healthcare providers ask about like these very rare conditions and focus on very rare conditions, but not these things that happen a lot, right? So that's number one. Part of what we do as a health resource center is just help providers understand, like, you are not providing the best care if you're not addressing these other issues that are happening in people's lives. And Millicent, you can come work at the Health Resource Center on domestic violence. You got it down. Why this is important. And I would also add, we also know there are a ton of people that are, even if you are so skilled and ask the questions in the right way, even if this is part of their story, they're still going to say, no, it's not happening to me. And then that kind of shuts down the conversation. So one thing that we really advocate for is you just share information about community resources with everyone, right? This is for a friend or you, if it's, I'm so glad that your relationship feels healthy and safe right now. Relationships sometimes change. Maybe you'll have a new partner. Maybe your sister or mom could use this information. I'm sharing it with everyone so that no one feels like they are like a scarlet DV is on their forehead and you suspect that something's happening. It's just like, we know this happens a lot. We want our patients to be safe. So we're giving the information. If you can't use it, you can give it to someone else. Some people worry like, oh, it's going to be dangerous if they take the information home with them. Survivors know what they need to do, right? So you might find many of those cards or, brochures in your trash can, and that's okay. They've at least got the message from their healthcare provider that domestic violence is a healthcare issue and that it's okay to talk about it in this space and that there's help available.
Yeah, I think that's a great point about, well, they might not be safe taking it home, of like, let survivors have the option, right? So like, give them the information. Yeah, they might throw it out, but they might not be able to remember the number, but they might remember the name of the program, or they might just have some information that there is a program. They might not have known that to begin with. So there are different options for folks, but yeah, just giving everyone the resources just flat out is a way to sort of maneuver around that a lot of times. So thank you. Oh, Amber, did you have anything else?
I was just going to add that we don't even know how many pregnant people have been shot and killed in this country, because we have really challenging data and research on the gun violence. Anytime there's a firearm in any sort of data and research, it becomes very challenging in this country. But, you know, we do know, I was just looking up that in Philadelphia since 2020 till 2022, so I think until July of this year, there were 659 women who were shot, and there were at least 100 of them that were killed. And they think just this year in 2022 that there's been around 12 to 15 pregnant women who have been shot. And they don't know how many of them have died. And so I say all this to say that it's whatever the numbers are, they are staggering, and it's challenging because I will say also as a gun violence prevention advocate, there are many states that have things called gag orders where physicians legally cannot ask a lot of these questions specifically about firearms. There are more than a dozen states that have these. And so I think in places where they don't have gag orders, I always think about a couple of years ago, there was kind of famously, there was a bunch of doctors that were advocating after another one of these mass shootings. And some folks said, you know, stay in your lane. Then they started an organization that said, this is our lane. Where else are we supposed to be if we're not advocating for our patients and asking them what's happening in their communities or in their homes? So I think it absolutely is the lane of, you know, people within the healthcare industry, but people that can advocate for their patients, but also the advocates that are working with patients as well. But yeah, I think, you know, just the numbers are staggering, and it just the heightened risk that people have while they're pregnant, especially and early stages of pregnancy, if there is the intersection of domestic violence, interpersonal violence is just, and then intersected with firearms makes it even more challenging for our community. So I think making sure that we're getting the data and information to people about what's actually happening, but have strong advocates that are working inside a lot of these institutions is going to be really helpful.
So any other thoughts around some more intentional ways in which advocates can center the needs or center the realities or amplify those realities on a mainstream level?
We gave you some good ones.
Everyone's
Asking questions about patients' lives, giving materials to everybody, you know, asking about the pregnancy firearms, have community-specific resources, you know.
Yeah, and I think I brought up social media. My little sister makes fun of me because I'm on the cusp of being a millennial because I was born in 1980, and she's like, "You're not a millennial, you don't know social media." And so, but I am on social media, and I think all the time of when we hear how infrequently we hear about, you know, domestic violence and interpersonal violence and firearms. But, you know, when I see that there's a mass shooting or anything, like, even if there's a mass shooting in a, you know, in a small community and nobody dies, you know, we all as advocates will look and we'll see, oh, the criminal history of the person that did this. You know, it's going to lead back to some sort of domestic violence, and it's going to lead back to harming another person even right before they did the massive act or sometime in their recent history, and something has been escalating that nothing was done about. But yeah, I mean, I also think in like cultural, I just think of things like, I think of like Meg Thee Stallion, and I'm like, you know, she was shot. And I remember looking on social media and seeing all the different opinions of what was happening with her. And so I'm not saying that like, she should do whatever she wants to do in that situation. I don't know what happened to her. She hasn't told me, but I use as an example of like, there were so many different conversations going back and forth within our community about what did happen, what didn't happen, and what should happen to her and what she should have said and shouldn't have said, when she herself has said she's a survivor, right? And so I think that's, you know, as we think about mainstream, it's like, how do we make sure that survivors are telling their stories, not just of what happened to them and their pain, but also they're talking about how they are surviving. And as Virginia said, they're thriving. They're coming up with the solutions. They're leading the charge, but we also don't leave them out there by themselves, right? Because that's like, especially when we talk about gun violence and a lot of these really hard issues, we've left gun violence survivors just out there to handle this themselves. You know, you'll always see them leading the charge. Some of them are in high school and they're so young, or they've been in the game for 30, 40 years. And, you know, unless it's a big mass shooting or unless it's something that kind of bleeds, it leads, it's them out there advocating for themselves. And so I think it's really important. And when we talk about media and how we're getting this in mainstream culture, that we're thinking about how we can have survivor telling their stories of thriving and what this means, so we can intervene and prevent these tragedies from happening in the first place.
Yeah, I'd say similarly, it's really like listening to survivors, listening to Black people. We have the answers. We know what we want, need, and deserve. And then beyond just listening, like you have to invest, right? It's like a bunch of just feel good, write a report, here's some bullet points or jot dots. That's not helpful, and it starts to feel frustrating when people come to the community and ask for opinions and then don't actually do any follow-up. And then I think just acknowledging that racism and discrimination is a thing that has impacted all of us in different ways. And if I know it's like the jury's kind of out, but I do think that things like implicit bias training for folks, especially that are working in communities that they don't share the same experience, is really important. To just, everyone thinks that they're immune and, oh, but I'm not, and my best friend is whatever. But you come to find out, you know, we're all socialized, or those of us that grew up in the United States are socialized in a way that says Black is bad, white is good. And there are intentional steps that we all have to take to move towards being anti-racist.
And so my last question I'm going to end us out with, I keep thinking about Handmaid's Tale and dystopian worlds and all things happening. But if we were to create a perfect world where like reproductive justice is like a real tangible thing, what would it look like for Black survivors?
Can we like roll back the Roe decision? Can we start with that? I mean, to me, when you talk about like what does reproductive justice look like, for me, it's like a sense of freedom, so that Black pregnant people could make the reproductive choices and decisions that are the best for their lives and for themselves, and they would do so legally and safely and free of any repercussions from community or their partner or family. They are just free to make their own choices, the choices that are necessary for themselves. I don't remember if it was Virginia or Amber who said that survivors, they negotiate their safety, they make their choices all the time. I feel the same way about people in their reproduction. People make choices for themselves, and they should be free to make those choices. Things are a little bit different now in many states. People are not free to make as many choices. Things have been changing, and I would also say, you know, especially since we're talking about Black pregnant people in the Black community, you know, free of private choices. I wouldn't want, you know, religious considerations to come into play or things like that either. Free is free and private and confidential. It's your choice for your life to do what you would like to do.
Amber?
Yeah, I mean, freedom. I was actually, now I'm going to sound like an old millennial again. I was on TikTok and I saw this TikTok with Erica Alexander, who played Cousin Pam. She played Maxine.
Maxine Shaw.
Maxine Shaw. Somebody asked her about why, like, if Black people like science fiction, all this different stuff. She said that her partner told her that, you know, Black people have always liked science fiction. We've always liked all these different things. And she said that he said, the past for Black people in particular in this country, in America, the past is painful, the present is precarious, and the future is free. And so when I think of like what we see in the future, we see freedom and we see people being able to have this self-determination. And I think about self-determination all the time, because what would it look like if if survivors were able to determine what the future looked like and what the laws looked like and what leadership looked like, what the budgets, what the talking points look like, what would the world look like? And it would look very different. But I just think of that freedom, as Nelson talked about, and led by survivors, the people unfortunately closest to the pain every single day.
Y'all trying to make me cry over here at the end. That was beautiful. I think that reproductive justice starts the day you are born, right? So think about like bodily autonomy and how we allow children to control who touches their body, and how just from the very beginning to have a clear, age-appropriate understanding of consent, healthy rejection. I think medically accurate sex education, very important. And then just access to all reproductive health services. It is amazing to me that we obviously need people to have healthy reproductive lives in order to like continue our society, and yet we're not willing to invest, again, make that investment in people's health and well-being. It boggles my mind. And I'm also including in reproductive health services, I know we talk a lot about, access to abortion services, that kind of choice. Also things like fertility treatments, medical services for folks that would like to transition in some way. Like, we need to make sure all of those things are covered and understood as a right before we can really, see true reproductive freedom, I think.
Claps all around. Thank you all so much. This was an amazing conversation. I'm looking forward to having many more conversations like this with you all and bringing you back to different spaces to have these sessions together and conversations together. We will make sure to send out everyone's contact information to folks so that they can reach out to you, because you are amazing resources and sister friends to get to know. We really appreciate you all at Ujima. We really enjoyed working and coordinating this to begin with, and then to be able to have this session together and this space together to have this really important conversation. So thank you all so much. We really appreciate you all, and see you at the next Coffee and Convo.